Hi guys, welcome to the Board of Health meeting in our brand new building. I'd like to welcome everybody back to our home stadium. We've been on the road for a year, and we now would like to make this our permanent home because it allows all the players to continue working while we're doing our Board of Health meeting. Bobby, would you please do the official announcement?
Yes, so thank you, Dr. Stewart. So this is our Board of Health meeting scheduled for August 11th at 12:30 p.m. We are getting started at 12:40. We had just a little bit of technical difficulty. The meeting is being held in our physical building at 18 Mulberry Street. The emergency orders have ceased, and so our board has to meet in person. We have also made this meeting accessible via Zoom. The meeting ID is 863-9978-9686. The passcode is 271193. The meeting can also be accessed by telephone. The phone number is 1-646-876-9923. And if there's any problems with the audio, individuals can call 603-821-2049. This meeting is also being recorded.
Thank you, Bobby. We're going to have our agenda in two parts. First part, we're going to do the reports, what everybody's been up to, which has been a lot because we had last month off for moving. So if you could go ahead and give us your reports, but try to abbreviate them as much. Thank you. Bobby, you're first up.
All right, thank you. So for the update, I wanted to introduce, we have been working very diligently throughout the beginning part of this year on our strategic plan, and we've also come up with some values. So at our meetings, we'll be sharing our mission to promote, protect, and preserve the health and well-being of our Greater Nashville Public Health Region through leadership and community collaboration, with a vision to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And then our values that we have as a chief public health strategist are to subscribe to the following: integrity, leadership, adaptability, and respect. And so that's how we'll be rolling through the rest of the work that we do. I will start off first with just the highlight for us right now for this month is just the financial update. There's been some significant funding that has been made available, aside from the funding that we get through the city that was approved by the Board of Aldermen and the mayor for our 4 departments, as well as additional grant funding that we normally get to run the services that we have. So for fiscal year 22, all our funding has been secured for community health and community services. And on the report, you can see the programs that are funded by the grants. And in additional, the CDC had additional funding. We wanted to improve the public health workforce as a result of what came out of COVID and seeing the dire straits that across the nation some of our health departments were in. So there has been the release of crisis, they call it COAG workforce supplemental funding. And we've been offered funding to support efforts in our community health department. So they want to increase the STD and communicable disease workforce. And so they've offered us $150,000 extra for per year, and that'll be for the next 5 years. And we've also got some additional funding from the CDC for workforce from our state health department that averages about $143,000 per year. So that's exciting for us because it allows for us to also bring on some additional staffing. Because of what we identified with the COVID experience, we do plan to hire some behavioral health specialists or individuals that have that training, whether it's a nurse with behavioral health training or a staff person that has behavioral health training to help us be able to address some of the behavioral health issues for SUD, some of the communicable diseases, as well as helping people manage, what happens when you go through these different types of situations, because we did see an impact on mental health as well. And then it'll also allow for us to hire an equity officer. And so again, we want to make sure that we are addressing things appropriately when it comes to our equity approach that we're using, and also be able to address our social determinants of health. With regards to our operational updates, you're going to hear from each of the staff that have submitted reports. We continue to lead and work with our community partners to perform our core functions of public health and make sure that we can deliver the services that we have been ascribed to deliver. Next bullet, sorry, I'm going through, my glasses are all steamed up. I have a couple of bullets here as far as some operational updates. You'll see or hear there'll be some drilling out there. They're doing our doors. So about 99% of the work that needs to be done in this building has been done. And we hope that you guys will have a little bit of time afterwards so we can take you on a tour of the building. We had a few items on our punch list that need to be addressed. So the doors are being replaced. So the doors that you came in won't be there when you leave out because the new doors will be there. And then there's a couple of masonry things that have to be done because we have a little bit of cracks from the old construction that wasn't included with the work that needed to be done, but we found that we have a couple of leaks. So that's another little item that has to be addressed there as well. Our staff has picked up on our daily operations. We've been here for a little over a month now. We moved in on June. Oh gosh, it's been actually 2 months. So we've been in our new home for 2 months now. But our staff has picked up on some of the regular work, if you want to call it, that we've been doing. We're still providing support for ongoing emergency response for vaccinations because we're really trying to make sure that we can keep our vaccination rates up. And we're continuing to do our joint calls with our joint partners on situational updates. We still have our weekly newsletter and our updates on our TV Public Health Matters. You'll hear updates on those. You'll hear update on our strategic plan. We're in our final version. It's in review right now. And hopefully we'll have a brief update on where we are with our accreditation preparation because we've started that as well. We have medical students that will be coming in starting this month. We have a CDC public health associate that will be joining us this month. And then some of the nursing schools have already reached out for their planning for workforce development for staffing. And that's it. Oh, and I do have one highlight. I was invited to a Lions Club meeting this week, and I didn't realize that they were going to do a certificate of appreciation for the work that the staff has done. They let us know last year that they identified and wanted to recognize us, and then I forgot that they were going to do something this year. So they have given a certificate of appreciation to public health. May it be known that this certificate has been awarded to our National Public Health, our nurses, and our staff of the year. So we got the staff of the year award in recognition of how you have performed in a community at a time of crisis. So we appreciate this recognition from the National Lions Club. And that's my report. I know it was quick,
Okay.
but that's it.
Any questions to Bobby?
I have a question and a comment. One is, when is the accreditation due? When do you anticipate them to come?
So I can give an update on that. So accreditation every 5 years. So we're due for the re-accreditation process that's going to open up January 1st, 2022. We assembled our team this past month and are meeting to review everything that's going to be due for that process. And we will be working on that over the next several months.
Excellent, thank you. And Peter Daniels was a student that assisted you in some public health matters and some screenings, and he's off to medical school.
Oh, congratulations.
And so his experiences here definitely informed his application. I do believe he's interested in infectious disease. So sending thanks and greetings from the family, and we'll look forward to hearing great things. Maybe he'll come back and help us in a couple of years.
It's awesome.
So thank you.
It's nice to hear.
Okay, any other questions? Seeing none. Next on mine is who we help?
Hi, good afternoon.
Hi there.
Hi there. Kim Bernard, Chief Public Health Nurse for the city. I'm reporting on July and August for our community health report. And I'll just be brief. You have the report in front of you. So for July, we continued utilizing our partners to do all of our outreach and in the community. We continued with all of our services that we've been providing throughout the pandemic. And in August, we've opened back up, as of last week, we've opened back up our clinics in the building. So that's been great. We've also rolled out our EMR, our electronic medical record. And so we have a little bit of a learning curve, but things are going well so far. Just for knowledge for the public, the immunization clinics are held here at 18 Mulberry Street on the garden level, which is the bottom level of the building, Tuesdays 4 to 7 and Fridays 9 to 12. And our STD, HIV, and HCV clinics, which is hepatitis clinics, are held on Thursdays from 3 to 6. We are doing things a little bit differently as we are asking for people to make appointments, and all they need to do is call our phone number 589-4500 and press option 2, and that will bring them to us and we can schedule an appointment right over the phone for them. We continue with, as Bobby had mentioned, continue with our COVID vaccination strategies. We're trying to reach the unvaccinated population. We continue with our pop-up clinics and other clinics throughout the region. And we've been increasing some of our outreach with partners that we were engaged with pre-pandemic as well. And that's a short and sweet overview of the highlights for us. Thank you.
Any questions for Kim? Thanks, Kim. Appreciate it. Hope you like it.
Thank you. Thank you. Oh, and I wanted to mention too that we worked closely with Peter and we're really happy that he's doing well.
Great. Thank you. Next online.
I know. I was waiting for that email.
Well,
I'll give just an overview of what our numbers look like today.
can you say
And
that?
we'll say that, yes.
Can I say that to you?
To get to the.
After Will.
Yeah.
All right, no.
Hi, it's nice to see you guys again.
Same here.
So busy 2 months, so I'll just kind of I put a lot on the report, but I'll just give a brief overview. So
Appreciate
as
that.
Bobby mentioned, we are still doing our weekly newsletter. That's really where we get a bulk of our information out to partners. Folks can subscribe to that newsletter on our website as well. So we have a lot of community folks who also subscribe to that newsletter. We just are continuing to get out COVID information, as well as we put a data update every week, and we do post general public health information in there as well. Other than that, we do have 3 billboards running right now to promote the COVID vaccine. So those are in Merrimack, Nashua, and Milford. I did put a picture in my report, but I have a picture that we got driving past. I just wanted to show you guys that. So that will be running. It's July, August, September, and October.
We got their hands on it.
We got our billboard company took that one. I did take another one. I did pull over. But that's the one that's located in Merrimack.
Thank you very much.
And then just in regards to the face mask messaging, so we have been continuing to push messaging, provide partners with signage and information that they can use. So our website's completely updated. We've been pushing information on social media and especially in our newsletter as well. Other than that, just busy with messaging for getting the community acclimated for us moving back to 18 Mulberry Street. So we put out a press release for that, and we actually have a new division brochure that's also coming out hopefully within the next 2 weeks. Not only do we have that in English, but we also have it translated in Spanish, Portuguese, Swahili, and French. So we're really excited. We're going to give our community health workers those brochures to get out to the community. It has all of our clinic information, welfare, environmental health services. So we're really excited for all of the services in one document. Also too, so August is immunization month. So we've been working really hard with the reopening of our clinic just to get information out about where folks can get vaccinated, especially with back to school vaccinations. We do have 2 back to school clinics in August as well. So we've been pushing that information out to families in Nashua and the region. And then we have been busy again with events this summer, which was really exciting. So we did have 2 HIV testing clinics that we held, one in July and one in August, just we had to postpone due to the heat. We attended the Tree Streets Block Party in Nashua in June, as well as National Night Out in Nashua in August. So those are great opportunities for us to be able to provide vaccinations, but also talk to families and get connected with our community. We also will be attending Nashville Goes Back to School on August 26th. So I've been in weekly planning meetings for that, and we're really excited about that event. We see about 1,500 kids and all of their families, so that's a great opportunity for us. And then we'll also be at the Brazilian Festival in Nashville at the end of the month, and hopefully Wheels and Wings in September. Other than that, so I just wanted to mention too, we did complete in June our environmental public health tracking grant, which are it was a 3-year grant focused on child-lead poisoning prevention in the region. So that officially came to an end, but we still are promoting lead poisoning prevention and testing information, especially at these events that we're going to. And I will actually be presenting at APHA on all the work that we did for that grant as well. And that's pretty much it. I've also just been working with Jane and the team on the strategic plan. We have a goal on communications for internal and external communication. So I've been kind of facilitating and leading that section of the plan. Pretty much all I have for my report.
Thank you, Nicole. Any questions from Nicole? You good? Public health strategist.
Can you hear me?
Yep.
Okay.
Jane?
Yep, here I come. Sorry. I was having
Okay.
some microphone issues, so I'm glad you can hear me. Otherwise, I was going to run across the hall. So good afternoon, everyone. Just basic responsibilities, continuing to host public health matters. And we've been doing that every other week. And this summer, we've just had the National Fire Marshal on. We talked about tick prevention, health equity, and back to school immunizations. And today I'll actually be trotting out of here a little bit early to meet the interim superintendent. And that should be a great discussion about opening school up. Continue to work on the community health improvement plan. Just as a reminder, the Public Health Advisory Committee Executive Council voted on 5 priority areas: public health emergency management and substance misuse and behavioral health are required by the state. And in addition, we have maternal and child health, communicable diseases, and chronic disease. I have been leading the chronic disease work group in that area, and we've selected integrated behavioral health as it relates to chronic disease, diabetes, and we will add one more primary prevention area to our efforts. Also a co-lead on the Kresge Foundation grant, which is addressing provider and health trust in the BIPOC community. And finally, last but not least, on the second page there, if you want to move the document down, I have been the lead in conjunction with the strategic leadership team on creating a strategic plan that runs from 2021 to 2024. Normally, we would have started in 2020, but as you all know, 2020 was a little bit of a lost year in doing some of these projects. So we've adjusted, and just to let you all know, Bobby mentioned it briefly, but our overarching goals in the strategic plan are advancing health equity into all work practices, improving the use of technology to optimize the delivery of our public health services, to diversify our funding streams to ensure sustainability, to develop, sustain, and pursue diverse partnerships with community stakeholders, and to improve internal communications, external communications. There's a little typo there. As Bobby mentioned in the beginning, at the top of the hour, we did a lot of cross-department work on value statements, and she mentioned, so I just put them in here. These value statements we've already published in these beautiful colors, and they're hanging all over our building. Really proud of how this was a division-wide effort to come up with these words that reflected our core values. So again, integrity, leadership, adaptability, and respect. And last but not least, the final plan is in a draft format. It's in review, and we're getting really ready to implement that as soon as that draft is published. That's it.
Thank you very much. Any questions for Jane? I have a question here for you, Jane.
Jane, Stephanie. Good afternoon. Thank you for this wonderful work. The poster is great. The timeline being proposed for full approval by the FDA of the vaccines is felt to be within the next month. And I actually heard that their goal is Labor Day. Whether or not they will be able to complete the requisite review of the thousands of pages of documents. I know they don't want to rush it to interfere with any credibility, but we can anticipate that before long, we will have FDA approval. This will be a game changer for some people. Surveys have shown that 3 out of 10 individuals may change their minds or change their stance in becoming vaccinated once they've seen that the FDA has gone through its normal process rather than the expedited emergency process. And I'm just wondering what educational public service announcements we have shelf ready to take advantage of that change that may affect so many people before we get to the winter, where more people will be indoors, where the Delta variant with its increased infectivity will be the predominant strain, and where our children will be back into school, because the vaccines being the most proven way of reducing the burden of illness and the risk of hospitalization and death. I would want to make sure on behalf of the board that we took full advantage of that.
So that would be a question for the whole.
So that's definitely something we see in our community members who are hesitant, that has come up many times. So I know we'll be working closely with our nurses to really use that as an educational standpoint. That's going to be great for us to be able to get that information out to the community. So we are ready to do that. When that happens, our community will be pushing that out right away. And working very closely with our nursing staff on that as well.
So one of the things that we've spoken about, and I was very proud of the city last night, receiving kudos for making sure that we are a welcoming environment for people from all backgrounds and all circumstances. I wanted to know, and you can address it in your remarks, what we're doing to leverage our relationships built over the last 18 months and more with the faith-based communities, with the minority communities, with the immigrant communities, so that their leaders have the information so that they are our partners in producing this information.
Sure. So what we have been doing over, this entire period with increasing tests and vaccinations, we've engaged our faith-based communities and have actually been able to do some of our testing on site at some of the churches that have made the space available. St. Louis de Gaza is one for example, and also the temple. That's Abraham has allowed for us to do vaccination clinics at their site, and then we've gotten offers from others as well. And so we've been working with our community health workers and making those connections in the community with those faith-based leaders. Lisa Vasquez, who is our behavioral health strategist, along with a couple of our community health workers, Sylvia Tata and Abimana, they've engaged faith-based community in the Brazilian and in the African community, and they're actually holding meetings right now with them and keeping them engaged with looking at working with families with behavioral health issues or getting messaging out with regards to that. And it also allows them to talk about like COVID and the impact of COVID on behavioral health, as well as share additional information about the vaccination clinics. Jane mentioned the Kresge project that we have, which is another one of our new grant funding sources. I think I reported out in the last meeting that we had, we got an award, $50,000 to do some work to build trust and look at what are some of the reasons for mistrust in the community and some of our Black, Indigenous, and other people of color population groups. So that has allowed for us to again bring some of our community members, which include some of the faith-based leaders,
to the table to work on doing some of that work. So we've got them engaged in a couple of different projects as well as the ongoing work with the vaccination clinics. And I just got an email from someone today asking about testing, so we'll have to talk about that a little bit later. But people are already starting to ask about that since the rates are starting to go up. People have been going out on vacation, and now they want some follow-up. So we'll have to talk about that. Our internal team will meet on that for planning. But that's a very good question. So we've engaged both our BIPOC and our faith-based organizations through some of the work that we're doing.
Any other questions? So none, moving on to environmental health. None.
Thank you. Heidi Kupratoka, Health Officer. We'll go over this very briefly. We're in the midst of getting caught up with food service inspections post the COVID shutdown. And we employed a soft approach for that initial inspection where it is simply pass-fail, but it's not just with a reinspection fee. And there's no score attached to it either. And we're finding that facilities are starting to do a little bit better. And I think that it's one of those messages driven home that the more often we're in a food service facility, the better off that they do and the better they perform. So that's good and reassuring for us. Oops. And we had no license suspensions, but we did put a placard on a facility that was operating without a license. And we're aware of their existence, but they still have some work that they need to have completed within the facility. So we're still doing some temporary inspections here and there. We have met with, what is Paul's title?
Executive Director of Preparedness.
To talk about the upcoming big events for the city and where we are with numbers and what our recommendations are. And he's been a very amenable to working with us and asking for our help and our guidance. So we're looking closely at a couple of big events that are coming up. And pools, we're doing our first sampling run back in this new updated facility with our new lab space. So we collected pool samples today and getting some good headway with our pool inspections overall. And then it just told me that coming in that there were 3 facilities that were shut down for the season. So things are still not completely back to normal yet. So I'm sure that you guys saw on the news that there was the 1 fatality due to Jamestown Canyon virus in Dublin. The state is running a pilot testing program for the presence of Jamestown Canyon virus in mosquitoes. We'll know more information when that they're done with that. I'm curious to see what kind of funding may be available to continue that specific testing. But as Ren and I have discussed a lot, it's here, it's been here, and we need to treat everything with precaution as we normally do and avoid mosquito bites and avoid containers around homes and those types of efforts. And what we're going to do is we're going to start a little bit more of a stronger campaign around prevention here. Nicole. Conducting our mosquito surveillance, and we'll see what happens with that. We typically have positive West Nile virus mosquitoes if we have anything. So fingers crossed that there's nothing worse than that. But our environment here, we don't have the white cedar swamps that tend to harbor mosquitoes that carry triple E. And we don't have as much swampland as would support mosquitoes that would carry Jamestown Canyon virus in Nashville proper. The rest of the region, however, that's a different story. So we're just trying to be mindful and hit both audiences. Brendan, is there anything else you'd like to add?
I would just like to quickly add that we still are receiving phone calls from some of the business owners regarding COVID. They've been
Yes.
very open and responsive with us. Which I think goes back to a point made of, we are still in the process of engaging the business partners and making sure that we're pushing out info regarding the vaccines and testing options. And that has also been a lot of questions that cropped up is for testing options as more things are happening. So we continue to work very closely with them, and we're very happy that they call us and ask us for the guidance.
Any questions for Heidi or Ren? Any questions for Heidi and Ren?
So do you think, since COVID and your kind of attack, I guess, maybe not personally, but just professionally, as you're seen as the bad guys instituting social distancing and all the requirements, do you think you maybe in the business world community then fallen out of grace, but had you a more collaborative referencing what you were talking about there? I can see someone now with the tide turning and COVID on the rise, that maybe they're going to not be so open to perhaps some of the things we're going to be talking about. So do you feel that's changed, or has it been better back to what it was before?
So I think the attacking may have been only a small amount of places that were doing that.
Okay.
And those are the ones that were typically not following the rules anyways. We've had a lot of business. I would say we've had more reaching out for guidance than we did to reach out to complain. And I think the ones that didn't understand it at first understood it when they had to shut down.
Excuse me. I'm a visitor at the meeting and I can't understand anybody. I'm a visitor, a citizen. I can't understand anything that anybody's saying. I'll mute myself again. It's not
We'll try
clear.
to be loud. We'll try to be louder, okay?
Yes, please. It's very muted. I haven't heard a thing. And then also the meeting was not posted on the calendar and nor the Zoom. I had to call the alderman's office, the administrative office, to get it. So nothing was posted for the citizens. All right, I will mute myself. Thank you.
Okay, we'll try to speak louder. Just mass can kind of mute, and for some of us that mumble anyway, it's always a challenge, but I'm sorry, and we'll try to do better.
All right, yes, and I'll try to guide my speech towards the laptop where the speaker volume is, so everybody cannot hear. But as we were saying, the businesses have been working well with us overall and continue to do so. I think they were a little hesitant at first when we were back out there doing our normal jobs, but I think, like Heidi was saying, they're getting used to seeing us out there and having us out there as an opportunity to ask more and more questions, which our staff are also getting. So it's, again, very helpful to continue to build those bridges moving forward.
So, may I follow up?
Okay.
So some months ago, in order to support the businesses that are working so hard to make sure that they're implementing all recommended practices to keep their staff and patrons safe, we talked about a checklist of best practices that they could voluntarily post in their window that would be a public health checklist so that patrons, so they could get recognition for participating in, the public health information meetings or, doing contact tracing, not that these things would be mandatory, but just so that people that were patronizing the restaurants and such would have knowledge of what their practices are, and then the patrons, clients would be able to make their own decisions. Has that been considered again?
So that's an interesting point because we were just doing some pool sampling earlier. If we want to transition to a different business model, and we had a guy there that maintains the pool, and he was stating how they had still posted our signs to like social distance, and really used our guidance to make sure that signage was actually posted. Most restaurants were happy when the state decided to expire all the orders, so they took most of their stuff down. But there still are some out there that do post our signs. We do still see our signs up in many places, at least as just a mindset, right? Just to remind people that we're still in this. There may not be so-and-so rules, but we're still in the midst of this. So it may not be as active as it was, so it's more passive stuff that we're seeing, but it is still out there.
Right, and it's more best practices.
Thank you. Any other questions? Seeing none, we're moving on. Bob, from welfare, please.
Yes, good afternoon. Bob Mack, Welfare Officer for the City of Nashua, reporting on the Welfare Department statistics information for July, the start of fiscal year 22. So as you can see from the report, we had a slight increase in expenditures compared to last year at the same time. You can also see it's basically attributed to the fact that we had some burial cremation assistance and an increase in utility assistance lines. So we had 2 households that had received assistance for cremation in the month of July, and a number of utility assistance requests for this July. So that's primarily where the increase is. Slight increase in the shelter costs, which is primarily due to the fact that housing is a bit more expensive now than it was a year ago. So regarding contacts and interviews and decisions, that was no real significant changes there. The actual numbers of vouchers issued did not change very significantly either. We did assist 7 families and 1 individual in some temporary emergency motel placement. This is on the 2nd page of the report. And we're able to refer 2 families to public shelters during the month of July. Some of those households actually have moved on into other alternative, more permanent housing as well. We continue to work with our crisis assessment and referral system, which is part of the Greater Nashua Continuum of Care, and we refer homeless individuals and families to that assessment system. We typically do not see as many homeless individuals coming through the welfare department because they're mainly getting their needs met through that crisis assessment and referral line and getting more direct referrals to shelter programs without needing to come through the welfare department. So to date, we've expended about $12,856 of our FY22 budget for general assistance, and we continue to operate under the statute RSA 165 and our general assistance guidelines. We continue to refer to alternative resources in the community as available and appropriate. That's really all I have at this point. Oh, one other thing. We are monitoring the impact of any changes with the eviction moratorium. The moratorium, the CDC moratorium had expired, but then they extended the moratorium through October 3rd for counties that are experiencing levels of high transmission. So that's something that can kind of fluctuate a little bit, and we will just continue to monitor that and the impact of that on the welfare department and any requests for assistance. With that, I will say I have nothing else unless there are any questions.
Thank you, Bob. Any questions? Yes, Stephanie.
Bob, so between the eviction moratorium instability that you just described, as well as the increased mortality rates in the United States related and unrelated to COVID, or perhaps because people aren't seeking their usual medical care, are you at all concerned about the budget and being able to meet the needs of our population in the upcoming year?
Thank you for that question, Dr. Wolf Rosenblum. I don't think we're overly concerned with the impact of the budget. I mean, the moratorium could have an impact. We have still been seeing some folks coming in for some assistance with rents and to prevent any sort of eviction action, because even under the moratorium, some evictions could still take place. But I mean, our main concern would be that if someone just didn't pay any rent and didn't do anything to seek any assistance for an extended period of time. If they come in and they owe 4 or 5 months of back rent, it's a bit more challenging to help them than if they owe 1 or 2 months. But the state emergency funds, or the federal funds that came down through the state that are being administered by New Hampshire Housing Finance through the CAP agencies, that has helped a significant number of folks. And I think they've spent somewhere in the neighborhood of $30 million across the state, which is some 5,000 applications that have been processed, with, I believe, 4,000 some odd that are still being processed. So, and they're probably getting more every day. So we'll continue to refer people to that. It is a good question, and that's why we're going to continue to monitor it. But at this point in time, we don't think we'll have a significant impact and be over budget for this fiscal year, but we'll continue to watch it.
Thank you for that information. One follow-up comment. I had the privilege yesterday of listening to an excellent presentation by the nonprofit organization called Sleep in Heavenly Peace that I had not heard about before. You all probably know about it, but they construct beds and bunk beds for children living in difficult circumstances where there may be housing, but the kids are sleeping on the floor. And so it sounded like people would, need to sign up on the internet and identify themselves and apply. And I don't know that everyone has the capacity to do that. And I just bring it to attention because you have an awareness of persons in distress, and that maybe that organization, I think they're a little oversubscribed right now, but if we could incorporate that into our menu of resources and referrals, I think that would be very helpful to some families.
Thank you for sharing that. And it's good information. There are a lot of programs like that are out in the community. Some are, there's more awareness of than others. We do have a good network of nonprofit organizations and volunteers, and it's a great community. And it's a great community effort to address different aspects of poverty and its impact on our community. So thank you for that.
Thanks, Bob. Any other questions? Seeing none, Bobby, what you do?
Yeah, so our epidemiologist is out on maternity leave, had a beautiful baby boy, Vincent, who we adorably call Denny. And he is doing amazing. He's beautiful. She sends pictures every now and then. So I have not asked her to give us an epi update, but I do have some numbers just to give us a situational update and awareness. These numbers change daily. I've given the mayor some numbers. By the time he was reporting out last night at a meeting, the numbers had changed because they updated them at 5 o'clock. So they change daily. I'm just going to say that on the onset. So the global numbers actually come from the Johns Hopkins website, and currently worldwide there's over 204 million total cases. It's more than that, 0.3300,000, and we're at 4.3 million total deaths globally. In the U.S., we're at 36 million, 76,974 cases, and we've had over 618,000 deaths. In New Hampshire, so statewide, right now, we had a report of 89 cases as of August 10th. There's an average of 158 cases per day, and that's over a 7-day period from August 4th to August 10th. We've had a 41% increase in a 7-day period. So if you looked at this yesterday, it would have had 60-something% increase. If you looked at it the day before, it would have had a higher number. So we still continue to see a trending in our upward number of cases. So in total, we've had 102,205 for New Hampshire. We currently have 259 active cases in the state. With regards to Nashua, currently we have 116 per 100,000. Our test positivity rate for the city of Nashua is at 3.4%. We've had 104 new cases reported and currently have 52 active cases. In total for Nashville, we've had 8,309 total cases. We have had a total of 185 hospitalized and 96 deaths. So we haven't had any new deaths reported in the past couple of days. For the state of New Hampshire, what do we have? 52 current hospitalized and 1,391 total deaths in the state. With regards to vaccination rates statewide, we're at 53.8% that are fully vaccinated and 58.6 have at least had one dose. So we still have more work to do with vaccinations. Currently across the globe, nationally and here in New Hampshire, we have a number of different variants that are spreading. Right now, about 83% of all the cases that are being reported, again, globally, nationally, and in New Hampshire, and all those numbers came out to be the same. Dr. Chan did a presentation for us, and about 83% of those are actually showing that it's the Delta variant that is spreading the quickest amongst individuals who are unvaccinated, and even in folks that have had breakthrough vaccines. So what that means is people have been vaccinated, they've tested positive, have very mild or minor symptoms of COVID. Again, that has been the Delta variant. A person having breakthrough does not mean the vaccine doesn't work, because those folks have not ended up in the hospital. And many of those, if they were not immunocompromised, have also not died. And so we have evidence that the vaccine still works, despite the smaller number of cases of vaccine breakthrough that we're actually seeing. So we're still encouraging individuals to get vaccinated that have not been vaccinated. We're still pushing for that, not just in Nashville, but statewide, and also, nationally as well. And we really believe that the vaccines will help us. Right now with this trending up, I still call it a bump. I'm hoping it's just a bump, but if we engage, with our messaging and help people make decisions based on the information that we're providing, all we see is a bump. So that means it'll go up, it'll plateau, and it'll go down. That's what our hope is. So that's our every update.
Also, emergency preparedness.
Emergency preparedness. And so right now we are still looking to fill our position here. I actually got 3 applications today, so I'm very excited about that. Right now at the state level, we are looking at emergency preparedness and recovery. So they've added that on to our response efforts, because we are in recovery phase right now. The most of what we talk about on our calls that we have weekly is about vaccinations. Again, trying to get people vaccinated. There is a mobile vaccination van that goes out from the state, and anyone can go on the state's website, click on the link, and schedule a vaccination clinic with this mobile van, and they have been getting around pretty much. And so for right now, as far as FEP or emergency preparedness, all of the operations, all the focus is still around increasing vaccinations and promoting and being at information.
Thank you very much.
No, well done. I mean, that's the message. That's the message. Oh, it's a bump. So.
Okay. That being said, we are moving into the public comments section. Do not have control of the computer, so public comments, somebody's going to have to.
People can unmute themselves, can they? Yeah. So if we have anyone from the public, the chair is asking if there's any public comment. You can unmute yourself. Yeah.
Hi, this is Dr. Stephanie Wolf Rosenblum. Wow, that's loud. I know. I am. I'm talking through here because we're worried that there are several public members that may not hear our invitation to speak. They are still muted. So if either Christopher Weir or 603-921-2563 would like to speak, if you could please unmute and make your presence known, please introduce yourself.
This is Christopher Weir. I can hear you clearly. I have no comments at this time. Thank you.
Thank you, Chris.
Yes, hi, I'm the 2563.
Okay.
Can you hear me?
Yes, I can. Do you have a name?
Hi, yes, thank you. My name is Christine. I'm in Ward 5. I just have a question. Is there any effort to push the antibody test in the public instead of pushing just the vaccine?
At this
Are there
point
any
in time,
antibody tests available?
at this
I
point
await
in
your
time,
response. Thank you.
You're welcome.
so at this point in time, if individuals want antibody testing done, they have to get that done through their primary care provider. That is not a test that we offer through our public health department or any public health entity at this point right now, but individuals can request that through their primary care providers.
I didn't hear the,
Were you able to hear her? Two, 563, you're muted.
hi, I'm sorry. Can you hear me now?
Yes.
Yes.
Yeah.
Hi, I heard, thank you for telling me to go to my primary care provider and you had explained something that in the future you can call, and then I didn't hear the remainder of the statement. I'm sorry. You said to go to your primary care provider, and then you said to go through, call something or go through you can, and I didn't hear the remainder of the statement.
Yeah.
Oh, yes, I'm sorry. You can call your PCP if your primary care provider if you'd like to get that kind of testing done.
Right. But okay, so that was it. I thought you had an additional statement on that. Okay.
All right, thank you.
All right. I was just hoping that they would become more readily available, and if you knew if that's coming from your emergency management and through the governor's office, is that becoming more available for the public instead of just vaccine? Because it's not that I don't want to get vaccinated. I have a feeling that I have the higher, the stronger antibodies, and I'd like to get tested. And also I have some underlying health conditions that kind of might, makes it that the vaccine might not be the best alternative for me. So I will follow through with my primary care, but I was just wondering if there's more options coming down in the future for different types of vaccines, that might not, that would be more suitable for people like me. I was just wondering if that's coming anytime soon.
I don't believe there's anything that we've heard of so far. I do understand. I understand what you're talking about in your particular medical situation. So I think the first step is to talk to your primary care person. They may have other avenues that they know of and that may be available to you, but nothing that we know about in the public health arena. Does that help?
Yeah, that does. I just would like to see that, things are moving along, that it's not just the same one, that things are, that they are doing different things. Okay, I appreciate that. Thank you.
Okay. Hang on one second though, before you take off. Stephanie, can you maybe?
Yeah, this is Dr. Stephanie Wolf Rosenblum. If you can't hear me, let me know.
Oh, I can hear you.
I think the underlying question is, can we use antibody testing to identify people who either due to prior COVID infection or prior vaccination don't need to be vaccinated, don't need a second vaccine,
right,
will not need the booster shot that is now being discussed.
Right.
And the answer is, it is not anticipated at this time in the medical community that levels of antibody will allow us guidance in who should and should not be vaccinated. This is especially true due to the Delta variant and how much more infectious it is. We do know that people with immune deficiencies, various autoimmune diseases, diabetes, and others tend to have lower antibody levels. But antibody levels are just one measure of a person's immunity. There are memory cells in the body and other things we have not been able to harness to answer the question. But we do know that there is great vulnerability in the community. And actually, I would like to, if I may, Dr. Storas, pivot for a moment to a decision that was made by the Board of Education within the last week to require masks in the schools. I know that the decision was not unanimous, and I know it's controversial for some parents. And what we heard at our emergency board meeting last Thursday night was some concerns about masks and what their effects are on children. I have also heard it said in various venues in the community that children are not susceptible and children don't get hurt. As we quoted the other night, 400 children in the United States have died. And if you consider that a school bus holds about 70 persons, if you sit the kids 3 across, and that 400 kids would be a number of school bus crashes. And if we had a crash a week for 6 weeks, 7 weeks of kids, and every one of those kids died, people would be standing on the rafters asking why, what happened, what can we do to prevent vulnerable persons. And so I think it's really relevant for us to think about how to provide education within the community in the next several weeks leading up to the school year to allay parents' concerns, to provide reliable information about masking. I have a 7-year-old grandson that's gone to school with a mask, a 3-year-old that's gone to, his preschool with a mask. So it's not just academic for me and for other families, but I'm hoping that we can help those in our community that are struggling with this requirement that has been made by the Board of Education. Would anybody from the Public Health Department be able to follow up on that? As far as, as what you think is reasonable that could be accomplished within the next several weeks. I don't know if Jane is still on. My Zoom is quite unstable. So.
Yeah, I can just say it's Nicole Shu, I'm the health promotion and communication specialist. So we have a great relationship with the school district, especially one of their administrators who really focuses on communications and has a really great relationship with the parents. So I work with her regularly throughout the COVID pandemic and continue to. So I know that we'll continue that relationship and definitely reach out to them on how we can support them in getting that kind of information and education out to those parents and families.
And for some parents and families, I think there's a concern that going through, it's sad to say, but in these divisive times, that getting information from the Board of Education or from the school systems when this decision has been made might not be received by all persons. So again, all the things that we talked about for the vaccines, I would hope we could leverage those also to help families to have a comfort level with their children, in that regard.
Especially when you have the full back to school night.
Yep, I was just thinking that.
26.
Yep. We'll have plenty of staff, bilingual staff, our nurses who are going to be attending that event to give vaccines and to provide education. We're also going to be signing folks up for vaccines and back to school immunization. So we'll have plenty of staff who are going to be there reaching out to families and being able to answer those tough questions and just be able to provide information to folks.
Any further comments from anybody on the board? Or
Stephanie, also we work really closely with the nurses at the schools.
Very pixelated, we cannot hear you. You're fading in and out.
Me? Can you hear me? Can you hear me? Yes? Dr. Stephanie, can you hear me?
Like, we can hear you, Kim. I'm wondering if it's something in their room,
I think it might be.
because I saw Fokia shake her head that she can hear you as well.
Okay, they're shaking their head. They can, or they can't. I'm
Yeah,
not
we're
sure.
here. Sorry, we got muted.
Oh, that's okay. I just wanted to just add to what Nicole was saying, that we work really closely with the school nurses in the district and also the, the greater Nashua area as well. So the head nurse from the school district is actually one of our per diem nurses. So we work very closely and we push out information through her to her staff. So that's another layer that we have there.
Thank you, Jane. Any other questions or comments? Nothing?
So in this building, there are signs that say masks are required. It's a public health building. It is within the purvey of certain environments to mandate masks, require them for the health and safety of the staff, especially in a high-risk area like healthcare, like a public health building. We have previously seen during a period of the mask mandate that there was not sufficient support, political will, whatever you want to return to those kind of requirements. But I would like to propose, and I don't know that we'll have time to discuss it now or whether we need to have another meeting, because I don't want to shortchange the discussion. But I feel compelled as a member of the Board of Health to send a recommendation to the Board of Aldermen that, not for a mask mandate, because again, I don't think we have the political will, but given what the statistics are, given that even vaccinated persons are vulnerable in the face of the now, what did you say, 80% Delta variant, that we send an urgent message to them that they should be promoting themselves in their districts, not just through the efforts of the Board of Health, that masks be strongly urged, not encouraged, strongly urged, something of that manner. So I leave that up to you, Mr. Chair, as to whether or not you feel we're ready to send that kind of message to the Board of Aldermen for their meeting in 2 weeks, or whether you would like it to be part of an agenda item for a future meeting.
Can you give me the word? Write this down. Wearing masks are strongly
urged as part of best practices to reduce illness, hospitalization, and death.
Best practices, yeah.
To reduce spread of COVID, hospitalizations, and death, given the infectious nature of this new Delta variant and other emerging variants. That was basically simple messaging, not an ordinance, recommendation from the board. We don't design ordinances, we don't make rules, but it's incumbent upon us to advise the Board of Aldermen about important initiatives.
Can I ask if you walk through town hall, are you supposed to wear the mask? Is that a standard thing? That's why.
I was at
I know.
Board of Aldermen last night, and in the city hall, it says masks are encouraged. And I thought that was fine a month ago. I don't think that's sufficient now, in my opinion, for a public building, that people really, people can choose to go into a restaurant or choose to go other places, but our essential city services should be made to be as safe and as an environment as possible.
From, I think, any other discussion from the board and the division? I think we probably need to, whatever we're going to do, it has to be concise, to the point, and not kind of, the longer you make it, the easier it is to use that against the, whatever you're trying to do. So I think what we usually will see is kind of a preamble. These are the reasons why, and the resolution is this, or our recommendation is this. And that's the format that should be put in. Further discussion, well, that's tough because things may get worse before they get better. But on the other hand, we certainly should have thorough, thoughtful, insightful, researched discussion on what we want to present forward. And of course, we also need to actually work within the system to have champions on the board to make sure that it goes in that direction as well. So I guess the real question is, Chuck, do you feel you need more time to think this over? We could always have another meeting this month, which may or may not be hard for you.
No, I think my opinion medically would be, I agree with Stephanie, that I think we have to be ahead of the game. This is, if we put it in the format that we have something, maybe a little bit of that stuff that was
Preamble.
the preamble, and then the bottom would change, recommend, urge, and leave it at that. If they have done it, that's good. If they don't, then that's that. But
Is there anything you want to add to that?
no, I think that's succinct. I'm good with that.
Good.
We could wordsmith from now
Yeah.
until the cows come home.
Well,
Basic messages.
we don't need, then we really don't need this meeting. What we can do is Bobby, myself, and the two other board members can put something together and move it along to the board vote and have their job.
So, yeah, so we would put it to, we have to go from us to like one of the board members or
Right.
the liaison.
I would say the liaison. That's the proper channel.
Tom Lopez was on the call.
I can talk to Tom.
Okay.
That's easy. Yeah.
Alright.
So let me kind of work it a little bit, if you don't mind, get it out to you, if you're okay with it.
Great.
Bobby and do our thing. Yeah. We're good. We're unanimous in that. Okay. Thank you. Any other stuff coming from the division? I'm kind of lost track. We're good. Everybody's done their
September 8th.
reports. Everybody's done their reports and all that type of stuff.
Yes.
It has come to my attention that we have some conflicts on the 8th. So we'd like to change the meeting to the 15th. Will that cripple anyone?
Check my schedule. Is that
Okay, thank you. Appreciate it. Okay, so we'd like to move that, I mean, from the 8th to the 15th, and what we'll do is we'll shoot it into Bobby, and Bobby will let us know. I heard they're renting this out. Renting this for them?
Renting?
All right, any other things, comments? Anything from the public domain? Anybody want to speak? No, okay. Before we adjourn, I'd like to encourage everybody to enjoy the rest of the summer. 1 week in Labor Day coming up, enjoy with friends, families, and be careful and safe. Use common sense. Okay. Looking for a motion to adjourn?
yes?
Yes. Second? Yes, we are adjourned. Thank you very much for
Thank
coming.
you.
Everybody.